Representative, can you walk us through what your bill actually changes regarding parental rights over their children's medical records? Are there specific categories of care the bill treats differently, or does it apply broadly across all medical records?
Yeah, so it's mainly for medical records, with the exception of if it can't put Michigan law in conflict with any type of federal law, right? Because that'll really put healthcare professionals in a bad spot. So we took care of that, but what we're really trying to do is just simply allow parents to have access to their children's medical records, and there's been a number of issues with that over the last couple of years, as different healthcare laws and initiatives get enacted. There's a number of doctors who are saying, look, we've talked with our lawyers, this is what we have to do. There's even some healthcare systems saying, it's even worse. You have to have kids sign off so that their parents can see their medical records. In fact, I had a colleague of mine in committee mention this about his own kid, where they wanted the child to sign off before he could actually take a look at the medical records, so that then he could potentially sign off on any medical procedure. So it's just getting a little tough. And where this came from was actually a constituent who came to me, and we were talking about a completely different issue. We were talking about actually issues having to do with Eagle and some of the problems she was having there. And she goes, there's another thing I'd really like you to take a look at, because I don't know who to talk to. I brought my daughter to the hospital a little while ago, or to the doctor a little while ago, and the doctor, asked her if I should be in the room, or if I can have access to medical records. And that's just not right, because I'm a parent and I have to be able to have these medical records because I'm responsible for my child. I'm the parent. I'm the legal guardian. So I said, well, that's, I think that's something we can change. We can definitely clarify that in the law for you. I can at least, try and push it through the system. Well, after I introduced it and after we got a committee hearing, it was amazing to see all the parents that reached out to my offices, to other colleagues, just saying, look, this is really becoming a problem the last couple of years, and we really appreciate you guys standing up for parents' rights.
It's interesting because what you just mentioned there is when you initiated the legislation, the parents kind of came out of the weeds, and it sounds like something that I suspect the parents kind of felt like they were alone on, and whether they alone in experiencing it or alone on thinking that this wasn't right. Is that kind of the vibe that you got?
Yeah, very much so. It definitely felt like they just, there was nobody standing up for them, and who was going to make that change. And, to be honest, I'm not a parent. So I had no idea about this. I don't pretend to be an expert on these types of matters, but, I am a legislator and I can stand up for my constituents. And this was clearly something that I felt was wrong. This mother felt was wrong, who's also a very strong businesswoman. So, this was something we could change. And once we did, I think a lot of parents realize, hey, there's somebody standing up for us. So,
in my research for our conversation, the common scenario that was presented by opponents of this legislation was it was a minor, 15 or 16, goes to the doctor for a sexually transmitted disease that they, got from a boyfriend or girlfriend. And if the parents found out the child was sexually active, they would be in big trouble. And that fear would keep them from seeking treatment. That scenario does exist, but it's not common. Do you think lawmakers should create laws that, for lack of a better term, abandon the majority for the will of the minority?
Absolutely not. I mean, I think that would be a very, very much in the minority of a case. There was also thoughts of, what happens with, child abuse and things like that. My response is if there's an issue with neglect, let's say, if you're neglecting your child, how likely are you to then go and want to see these medical records if you're already neglecting them in every other aspect of their life, right? So I think parents, they're still responsible for their children, yet you're going to take information that they need to be responsible for their children, you're going to take that away, or you're going to somehow hinder that or put a roadblock in front of these parents to get that information, right? So, the majority of the time, the vast majority of the time, these parents are truly going to need this information. What if there's something medically wrong or there's a medical issue with the child? They need to be able to help guide through these medical decisions. And if they're not given all of the information, that's going to be a hindrance, and that's going to have some serious repercussions on the kids, unfortunately.
Under your bill, would a doctor still have any discretion to withhold information from a parent if they believe the child was in danger at home, which is the case under current law?
So the only exceptions, again, would be like for federal law, and then there's already some exceptions for, if there's cases of abuse, legal type things, where, for instance, like a court system says you can't do it, like those types of protections, we want to make sure are built in, and if those need to be strengthened, great, but we believe that there's plenty of those already in law.
Maybe you found it easy to draw the line in the sand for your bill at 18, but did you have any difficulties determining what age you wanted to cut off the parental rights to access of their children's medical records? Because the U.S. and individual states have so many varying ages where you gain rights or freedoms. Drinking at 21, you used to be able to buy tobacco at 18. You can drive at 14 and 9 months. You can vote at 18. You can be drafted at 18. Can't get a tattoo though until you're 18. A CPL at 21. Was it at all difficult?
Yeah, well, so when you're looking at medical records, I mean, our society says that you become a legal adult at 18. Now, as you just mentioned, we've also passed laws saying, well, even though you're a legal adult, there might not be certain things that you're responsible for. I mean, that's a completely different debate altogether. Sure. But if we say that, the coming of age is 18, you can, like you said, enter the military. You can go get a mortgage or a car loan or what have you. You are legally responsible for yourself at 18. Okay, at that point, you can have your own medical records, and whoever you want to release them to, that's up to you. Prior to that, though, unless you go through some type of emancipation process, you are not your own responsibility. There's a parent or there's a legal guardian up until the age of 18 that is responsible for you. And in which case, they're going to need to see your medical records. And especially when you're, 12, 13, which is where a lot of these stories are coming from, you need to be able to see those medical records, right? But, even at 15 or 16, you can't walk into a tattoo parlor and get a tattoo. There's some kids who have gotten them, but guess what? Their parents are there to sign off and say, okay, it's a family thing. We're getting matching tattoos or what have you. So that's another part where you don't even have bodily autonomy to get a tattoo, but somehow you shouldn't have that person who's supposed to sign off on that. You shouldn't be allowed to the doctor shouldn't be allowed to give them medical records for far more serious issues or diseases or complications in order to help make those medical decisions. That's just not right.
Bills like this failed in North Carolina and Ohio last year. What's different about your approach that you think will get it across the finish line here in Michigan?
Well, we already got it through the House, and we're hoping that the Senate takes a look. And we've started a bit of a grassroots type of push on it. I mean, it really has come from parents in general. So I'd encourage any parents out there to contact their state senators and say, this is an important bill. Can you see what it will take to get it up in committee and then hopefully pass it across out of the Senate chamber. Again, we're not going after any type of political issue with this. We're just simply trying to help kids and allowing parents to have the full information that they need to be able to help their kids.
Does it have bipartisan support? You said it passed out of the House, and so obviously the Senate controlled by Democrats. Did it have bipartisan support in the House?
It did. I wish we had more bipartisan support, but we had a number of Democrats vote for the bill.
Have you talked with pediatric groups like the Michigan chapter of the American Academy of Pediatrics who haven't taken a position yet? And if so, what's that conversation been like?
Yeah, well, it's varied from member to member. I think that's probably why they haven't taken a position. They're still taking a look, but you'll have some doctors tell you, hey, this is great, and we appreciate this because right now we're in this kind of legal quandary. I mean, you get 10 different lawyers who will give you 10 different opinions. Now that's generally true about anything, but this is a tough one. This is medical law, right? So, is a kid supposed to sign off? Do you just simply ask them? I know there's doctors out there because I've gotten stories from certain people saying, hey, I heard that this was an issue, and my family member had this issue, but with my doctor, we don't have this issue. My doctor doesn't ask my kids this. They're just kind of ignoring it, right? So there's, I think, this legal question as to how to approach medical records for minors after a number of different laws have passed over the last couple of years, and a couple of different healthcare initiatives as to how this operates. So I think that doctors, like I said, are in this kind of questionable gray area. And so I think the most that they want, is just true clarity. I think that's really what would help them out.
We are speaking with State Representative Joe Aragona from Clinton Township. Joe, thank you so much for your time. I really appreciate it.
No problem. Thank you.